So yesterday we talked about jaundice. Okay. So in that we discussed what is the jaundice. Okay. And how many types of jaundice. Okay. These are the basic things we discussed yesterday. Today we will discuss the clinical features, LFT and remedies. Okay. These are the three things today we will discuss. Let's start with clinical features of jaundice. Clinical features of jaundice. Okay. So basic is whenever the jaundice will happen. Okay, we understood pre-hepatic, hepatic, and post-hepatic. So basically, depending on the type, they are the clinical features. If it is hepatic involvement, we can see hepatitis also sometimes, inflammation of liver, which leads to we have anorexia, loss of appetite, no appetite sometimes. Okay, and second one is we have nausea. Okay, and another one is a dyspepsia. Okay, and weight loss, sudden weight loss or gradually weight loss or abdominal pain. Okay, these are the symptoms of hepatic jaundice. Fever, chills, backache, mild. These are the things you can see in the uh, mostly hepatic involvement. So in pre and post, the main is you can see the pale color in face, in eyes, in nails, in urine, in stool. Stool and urine are mostly post hepatic. Okay. Sometimes the stool become brown in color also. Okay. Or as usual, dark yellow color. So these are the symptoms you can see in the hepatic and post hepatic. Anorexia, nausea, dyspepsia, weight loss, abdominal pain, fever, chills, backache, and the face, eyes, nails, okay, all in pale in color or dark yellow color, even urine and stool. Sometimes you can see that brownish color also, stool. So these are the clinical features. Next, we have diagnosis. In the diagnosis, we have the three things. One is CBP, second one is urine examination, CUE, and third one is LFT. So these are the three blood samples and urine samples we have to collect and we have to test in the lab. We have to do examination in the lab. Okay. In this, we have large amount of TLC involvement and RBC sometimes if it is pre-hepatic because large number of RBCs breakdown is happening. So we will able to see RBC, low amount of RBC and HB. Low RBC and low HB can be seen and TLC will increase due to the inflammatory factor. Okay, this is the thing. One thing you have to remember. And in urine, Urine test, what we can observe that there is a urobilinogen. Urobilinogen is absent sometimes. If it is obstructive jaundice, hepatic mostly, okay, urobilinogen. And in the if it is hepatic and post hepatic, you can able to see urobilinogen present. Okay, so these are the things. And sometimes you need to check the stool test also, because in that you can able to see the bilirubin level is high, means it is mostly post hepatic jaundice or hepatic jaundice, both can be possible. Okay, so can we have the idea of CBP, CUE, and stool? Now the third thing is LFT. Okay, LFT means liver function test. So is an important test to diagnose the bilirubin levels. Okay, so the normal level of bilirubin in the body blood is 0.1 to 1 milligram. Okay, and if it is more than 1, it means the bilirubin levels are increasing. Okay, so this is very important. More than 3, okay, it is confirmed there is a jaundice. Okay, so this is the thing we have to remember about the LFT. So this is the LFT test. In other, we have other tests also, which gives the inflammatory condition SGOT, SGPT. Okay, the inflammation on the liver, the condition of the cells of the liver is explained to the SGPT, SGOT. Okay, depending upon the values, we have to check whether the liver condition is good or bad. Okay, so this is all about the clinical features, tests. Now the other thing is we have remedies. So what are the remedies we have to treat with this problem? So basically we have glandular remedy, that is LS2, because now liver also a gland, and second thing is a liver is a blood manufacturing organ according to electrohomeopathy. Bone marrow, liver, all these are okay. So according to that also you have to select the remedies. Okay, but primarily here function is disturbed, so we are taking functional remedy, that is S2, or you can take S5 also because of the metabolism. Okay, first metabolic remedy, you can select S5. Next is L1 and B. Okay, because to improve the lymphatic flow, and along with the lymphatic flow, the blood also be purified. For this condition, we are selecting S5 L1B or S2 L1B. Okay, you can see I can have to D5. Okay, if it is acute, you can take in D6 also. Okay, next we have, because if you are taking CS2, alternately you have to take C2. If you are taking S5, you are taking C5. Okay, so basically in the functional or structural changes will appear. You can see the infection of chances of infection like hepatitis, any part of the body, septicemia can happen. So we are taking along with that where one, we have to reduce the inflammation, we have reduced the infection level, so we are taking Y along. So this is also in D5. C2 or C5 were 1Y. So these are the basic and important remedy according to the functional part of the liver, according to the structural part of the liver. So these are the two remedies you can select. And along with that, we have to give importance for application. So because liver is situated in right side, so the liver right side is negative in nature. So we have to give positive electricity. So mostly we have to give B, or we have,
RE.
or else we have G, or else, because it is the infective part. So that's the reason we are selecting. Initially we have to give B. Okay. Along with, you can give S2 or S5. Okay, B. And we have uh, angiotensin. Okay, angiotensin group. So right side is A1, left side, left side is A1, right side is A2. So we are giving S5, A2B in D4 for application on the liver or left upper, right upper quadrant of the area. So, okay, so this is the for application. Other than that, according to the symptomatic approach, we have to symptomatic approach to relieve the patient with the condition. If the patient have abdominal pain, you have to add S10. Okay. Along with that condition, if the patient have urinary problem, you have to add C17. So along that you have to add according to the condition. Okay, symptomatic approach or conductive treatment also you have to do to reduce the symptomatic level of the patient. Other than that, we have you can use A3 directly in place of A2 for application. Okay, because of the post pre-hepatic condition. Okay, because of the destruction of RBC, because A3 is best remedy for RBC. Okay, WBC and platelets. So you have to add if it is pre-hepatic. Hepatic, the same remedy. Post-hepatic, you need to understand, is there any urinary issues or gastric issues? If the gastric issues, you have to add gastric remedy S10 L1 WE. If it is urinary issues, C17 YE or S6 C17 YE. These are the remedies you have to add along with the, if there is issue in post-hepatic, pre-hepatic or hepatic. So this is all about jaundice. Okay, but initially you need to careful about that, because if the septicemia is present, you need to treat the patient along with other medications and by doctor advice. And third thing is that you have to go the values. Okay, biochemistry values, LFT, CBP initially whenever a patient is having these symptoms with the uh, symptoms along with appearance. Okay, you need to check this value: CBP, CUE, LFT, and stool examination. These are the basic and emergency test we have to do for the jaundice. Okay, so this is all about jaundice. If any doubts, kindly ask.